The White House is implementing a new deadline which will require millions of American workers to get vaccinated against COVID-19 or undergo regular testing. It comes as government health experts testify on Capitol Hill about children newly eligible for their shots. Skyler Henry reports.
On the second full day that kids can get COVID vaccine shots, top public health officials were grilled about the ongoing response to the pandemic.
Vaccination, as we have seen, decreases your risk of infection by 6-fold, decreases your risk of hospitalization and death by 10-fold.
Republican lawmakers repeatedly pressed the witnesses about vaccine mandates versus natural immunity.
Are you so convinced that the data is so compelling that natural immunity isn't as good as vaccination?
If we don't know that natural immunity confers protection against future infection, it's because we've decided not to look.
The nation's top infectious disease expert, Dr. Anthony Fauci, again clashed with Republican Senator Rand Paul over whether the virus leaked from a lab in China.
You won't admit that it's dangerous, and for that lack of judgment, I think it's time that you resign.
He is egregiously incorrect in what he says.
The contentious hearing came on the same day the White House unveiled new rules, which will require millions of unvaccinated working Americans to get the shot. All federal employees, federal contractors, and healthcare workers at facilities receiving Medicare or Medicaid have until January 4th to be fully vaccinated. People who work at businesses with more than 100 employees must also be vaccinated by January 4th or test weekly and wear a mask at work.
Vaccine requirements are working.
It's a hard sell to tell people who have had COVID that they're now under a mandate.
More than 24 states have already announced plans for lawsuits to block the mandates from taking effect. Skyler Henry, CBS News, the White House.
For more, let's bring in CBS News reporter Alexander Tin. Hi there, Alex. So on the Biden administration's mandate of either vaccinating or submitting to regular testing by January, how will that be enforced?
Well, that's a good question. And, it's one that Biden administration officials have been asked and answered now repeatedly ever since they first announced this policy a few months ago. And their answer then is the same as it is now, which is OSHA officials believe that this, like all other occupational safety and health administration rules that apply to the workplace, will be voluntarily complied with by the vast majority of companies. There will be probably some bad apples, they say, who are either willfully defying the rules or, are negligent in enforcing the rules. And in those cases, the agency is going to, especially if they receive a complaint from workers, conduct inspections and work with the companies to try to make sure that they are able to implement this requirement. And in the cases where companies, even after the agency works with them, still refuses to implement the requirement, they will issue monetary penalties. But again, Biden administration officials have said for weeks, if not months, that they expect the majority of American companies are going to voluntarily comply with this requirement.
Well, if employees are granted exemptions, Alex, who pays for their required COVID testing?
Well, it's a complicated question, and really it depends on what kind of exemption we're talking about here. So we do know, for example, there are people with legitimate medical exemptions, that contraindicate them from being able to receive or complete a COVID-19 vaccination. We also know there are some people with sincerely held religious beliefs. Those two groups of people are completely exempt from this rule. They are not going to be required to test. They are not going to be required to be subject to this regime. But separate from that, we do know there are going to be some employees who are going to say, I don't want to get vaccinated and I don't fall into one of those exempt categories. And those people, OSHA says, are going to be required to pay for their own face masks and pay for their own COVID-19 tests. And the way that the agency justifies this is they say, employers are required to cover the costs of, the big, more protective option, which is vaccination. If employees choose to get less protection that isn't covered by the employer can't control that and thus isn't obligated to cover that cost.
Well, the CDC has issued new guidance urging those who have had coronavirus to get a booster shot. What are they saying about natural immunity developed after getting COVID?
Well, I should say right up front that this is not a new recommendation. They did issue new guidance, but the CDC has been saying for weeks, if not months, maybe since the beginning of the vaccine rollout, that they recommended all Americans, both those with so-called natural immunity from a prior infection, as well as those who hadn't survived a prior infection, who haven't had a prior case of COVID-19, that both of those groups, it was both safe and effective and would increase their protection against COVID-19. What is new and what came out last week on Friday is they released both a science brief and a new study examining the benefits that we see from people who have a prior infection and get vaccinated versus those who don't get vaccinated. What the CDC found in its own study looking at hospital records was that people who were unvaccinated and had a prior infection were 5.5 times more likely to get reinfected with COVID-19 versus those who were fully vaccinated but didn't have a prior infection. Add to that a variety of other evidence that compared those two buckets of people in their science brief that they released Friday makes the situation a little more complicated. We know, for example, there's declining vaccine effectiveness. That makes the comparison a little more complicated. We also know that there are many people who survive their COVID-19 infection but don't have the same level of antibodies as other people who survived their COVID-19 infection. And there's no easily commercially available way to compare those two buckets of people and know, I survived my COVID-19 infection. Do I have enough antibodies to not get reinfected or not catch and spread the virus to others? So there's a lot of complications there. I encourage people to look up that science brief if they're interested in reading it. But the bottom line is this. The CDC has said for a long time that people who survived a prior infection will benefit from a COVID-19 vaccination. It reduces their risk of catching and spreading the virus to others, and that the risks of side effects and what have you remain low and the vaccine is safe for that group as well.
Alex, I also want to ask you about this website, VAERS. It is co-run by the CDC to monitor adverse effects of COVID vaccines. Now, a number of anti-vaxxers point to this site as a reason not to vaccinate. Help us understand, Alex, the purpose of that site and how people may be extrapolating the data there.
Well, the irony is that in some ways, people who are in favor of vaccination, people who say that we have a really robust vaccine safety monitoring system, point to VAERS as an example of just that. What the system is that, after you get your vaccine, if you interact with the healthcare system in some way and you get some kind of adverse event, whether it's you getting run over by a car or having a heart attack or having potentially a side effect from the vaccine, regardless of whether your provider knows whether or not what happened to you is actually related to your vaccine, the CDC and FDA encourage providers to report when that happens. They use that data, for example, in the recent example we saw with myocarditis and pericarditis. Those are rare heart inflammation side effects that have been potentially associated with the Moderna and Pfizer vaccines. They've taken all these reports and they very carefully analyze and compare both the data they're getting from those reports and data from other health systems once they see what are called safety signals to measure, okay, we know that a certain number of people potentially are going to get heart attacks or heart inflammation or get run over by cars after getting the vaccine, regardless of whether they're vaccinated. We know that there's a so-called background rate of this occurring. But is the rate of this occurring more than we would expect? And what we've seen for all of the other side effects that the CDC and FDA have examined, based on reports in VAERS and based on other systems they use to monitor vaccine safety, there have been very extensive and careful analysis of does the observed outweigh the expected? And if that's the case, how much is that additional risk? And in all of the risks that they've examined, based on reports from VAERS, the risks have remained rare, so rare that the benefits appear to continue to outweigh the risks for most vaccines. So the bottom line is this. VAERS, like many other parts of the vaccine safety system, is an evidence that we know that these vaccines are safe.
Such important context. Alexander Tin. Alex, thanks very much.